that was a journey.
She lived her entire life thinking she and her mom were among just a handful of people in the whole world with an incredibly rare disease. But cardiac genetic testing revealed another diagnosis. And it also revealed that they have some good company on this journey. Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. Today you'll meet Alicia Smith and you'll learn more about her rare inherited genetic disease. But first we have some morning rounds today. Great Bend patients now have access to specialized heart care closer to home. A new telecardiology service will be available at Great Bend Hospital, connecting patients there with cardiologists here at Kansas City at the health system here. Please welcome interventional cardiologist Dr. Mark Wiley. Dr. Wiley is also the division chief of cardiovascular medicine here at the health system. Thanks for joining us.
Yeah, good morning.
So how would this work and how will this help patients?
Yeah, so we're excited about this, right? So one of the challenges with the state of Kansas is the fact that it's a rural state and access to subspecialty care can be challenging. So hospitals that have limited access to subspecialists, this gives us an opportunity to extend into that hospital and provide improved turnaround. So we could take a look at imaging, EKGs, talk about a diagnosis, and then help improve the diagnosis and the efficiency of the treatment plan.
So how does this impact the whole treatment and the experience compared to if it was an in-person visit, and how would this impact the diagnosis?
Yeah, good question. So an in-person visit is very practical, obviously, if you're in a center that has a cardiologist in place. Whenever we have a situation where there is not that subspecialty care, this is really potentially the only option. We can do pretty much everything that an in-person visit can do, minus some of the physical exam components, but we typically have an extender or another physician there who can help augment that. So really we try to reproduce the experience of an inpatient consult.
Such a great service to provide to all the patients. That's going to make things so much more convenient for so many people. Thank you, Dr. Wiley, for joining us this morning.
Yep, thank you.
And now back to today's show. We're talking about Alicia Smith. She was 7 years old when she was diagnosed with a rare inherited genetic disease called Hunter-McDonald syndrome. Decades later, her cardiologist here at the health system recommended cardiac genetic testing. The results were quite a surprise.
I've always been just very into art. I'm really into corsetry.
She's an artist, a filmmaker, a seamstress who makes her own clothing and costumes.
I made my cosplay. I won Best Beginner.
And 34-year-old Alicia Smith also has a brilliant personality.
So my thumbs are permanently dislocated.
Along with a sense of humor that emerges when you least expect it.
I like to freak people out with it. When I was in high school, my friends had a field day with it. They would like pretend it was like a video game joystick.
The loose thumb joints and severe arthritis in her hands are among the many symptoms of the debilitating disease called TRAF7 disorder.
I was born with deformed feet. I had my first surgeries when I was 7. 7th grade, I realized I was struggling to walk. I went to the doctor and discovered I was actually walking on dislocated hips. I had to get both of my hips reconstructed. Ooh, that was a journey.
In addition to skeletal abnormalities and arthritis, TRAF7 disorder is marked by brain tumor risks and heart problems. Alicia also has mitral valve prolapse, and it's genetic.
Kind of hard to treat all of our disabilities.
Her mom, Maureen, who survived a brain tumor, has the same mobility problems as Alicia.
Scoliosis surgery when I was 20. I had a pin put in my hip.
They also suspect Alicia's grandmother and uncle had TRAF7 disorder. Her grandma died from a brain tumor. Her uncle, who passed at 39, also had a brain tumor and a hole in his heart. But back in 1998, when they were first evaluated, Alicia's family was told they had a disease called Hunter-McDonald syndrome.
We were like the only known family in the United States known to have it.
27 years later, Alicia says her University of Kansas Health System cardiologist, Dr. Shannon Hughes-Thompson, suggested Alicia and her mom get genetic testing.
And I jumped at the chance.
The results were stunning. Doctors said the family actually had TRAF7 disorder, and Alicia has since learned from her Facebook support groups that her family is not the only family in the U.S. with this disease by a long shot.
Astounding to me. It was very eye-opening. I was flabbergasted.
I know, I'm like, she's gonna be shocked when she sees it's me.
Her doctors say the diagnosis has given them better direction when it comes to caring for Alicia and her mom.
She got to hear the concert.
Alicia says the diagnosis has helped her feel less isolated. Knowing there are other families like hers out there, she and her mom are not in this journey alone anymore.
It just opened my world a lot. I know for a lot of people, diagnosis is really hard, but a diagnosis is also a lifeline.
We are so happy to welcome Alicia's cardiovascular genetic counselor, Farah Amori, to the show. Thank you for being here. And we're also working to get Alicia's cardiologist, Dr. Shannon Hughes-Thompson, on. She's hopefully going to be joining us virtually from Olathe this morning, where she's working. First of all, Alicia, how are you feeling physically this morning?
I'm feeling pretty good, actually. A little sleep deprived, but it's okay. I'm just not a morning person.
Thank you for doing this. I know that you have so many projects you're doing, and they're usually in the evening because you're an artist and you're attending lots of conventions. Are you working on anything right now, any costumes or anything that you're making?
Actually, the convention that I usually go to was it was the weekend of the 13th, so I am done for now. But I made a whole evening gown. It was a lot.
Oh my gosh.
And then I randomly made a corset over this past weekend for no reason. So
just randomly. You just randomly made an intricate corset.
Randomly.
You're so talented. I want to ask you about when those genetic results came back and the doctors told you that you and your mom have TRAF7 disorder. What was the first thing that went through your mind hearing the new name for something that you had been calling something else for so long?
Oh gosh, it was, sometimes I'm still trying to get in my head that, you know, what I have is TRAF7 syndrome instead of, I've spent my whole life saying, you know, oh, I have Hunter McDonald syndrome.
Right.
And it's just, it's so different to say something different.
Sure, because
it feels
identity.
almost off.
Yeah.
Exactly. You know, I've spent so much of my life around this one thing that, you know, oh, well, it's called something different now. And my brain is still trying to wrap around it.
Sure, that makes sense.
I have to stop and think, and yeah.
That's a very human response to getting a big surprise like that. Now, Farah, for viewers who've never heard of TRAF7 disorder, what exactly is that from a genetic perspective?
Yeah, so it is a disorder that affects the TRAF7 gene. We all have the TRAF7 gene in our body, and it's supposed to be working in a normal way in the body. But in people who have a genetic change in that gene that is harmful, it can cause a genetic condition called TRAF7 disorder or related neurodevelopmental disorder. And what that condition entails is that it can cause problems with the skeletal system, neurodevelopmental delays, other organ systems may be involved, such as the heart as well. And so it requires medical attention from different specialty doctors.
So how often do cardiologists, well, let me back up. How many times before this have you done genetic testing and diagnosed someone with TRAF7 disorder?
That was the first time.
The first.
Yeah, she was my first patient with this condition. I had never seen a patient with this disorder before.
And from a genetics perspective, is Hunter-McDonald syndrome also something that you could find on a cardiogenetic test?
No.
Okay.
So this is a genetic diagnosis based off of physical symptoms or clinical symptoms. So the Hunter-McDonald diagnosis came about when she was about 7 years old in 1998 by a clinical geneticist here at KU. And actually it was fascinating to learn about Alicia's story because she sent me all the handwritten notes from that visit in 1998. So I was able to review all of her genetic reports and learn about her medical and family histories, and then offer her our current updated genetic testing, which is the exome sequencing. And I told her at that point, Alicia, it is possible that we could learn new information from this genetic test.
And how exciting that you did. And we do have, Alicia, we do have your cardiologist, Dr. Shannon Hoos-Thompson, now joining us virtually. Dr. Hoos-Thompson, thank you for being here. As a cardiologist, what symptoms did you see in Alicia that prompted you to say, hey, let's do some cardiac genetic testing?
Honestly, it's kind of in my own learning. You know, genetics, while there's always been some talk about it as far as the reality of how it applies to specialties, and in my case, cardiology, is very evolving area. And so for myself, and in Alicia's case, it was an opportunity for me to learn and have a better understanding of what's going on with her. And again, she's very well versed in her history and what she's been told about it before, but there were still some pieces about, I was like, you know what, I think we need to take a fresh look at this. And knowing we have such a strong genetics team that does good work here in the genetics realm, and especially in our cardiology department, I knew that was an opportunity to just kind of review this and make sure that we're working right with the right information and with the best we can.
It's such a good call because it led to this diagnosis that Alicia had not heard before. When we talk about Alicia's heart specifically, we know she has mitral valve prolapse and a heart murmur. We do have some video of mitral valve prolapse. It's an illustration of a heart with that. Dr. Hoos-Thompson, what happens in Alicia's heart with mitral valve prolapse? How would you explain that to someone without a medical background?
Well, so mitral valve prolapse, specifically the valve isn't able to close properly, that the laxity or the formation of the valve itself just doesn't allow for it to close effectively, which means over time excessive blood then backflows from the lower chamber, left side of the heart, into the upper chamber on that left side. And a lot of these patients then can get some congestive symptoms, but also develop arrhythmias and things like that. So that's the big aspect of the mitral valve prolapse, and what causes it for different people, obviously, a very specific reason.
So Farah, when a patient gets a rare diagnosis, obviously that's overwhelming. I mean, it really, Alicia's still the same person, but it really rocked her world.
Right.
So what role do you play in helping patients understand and process the medical news component, but also the emotional side?
Yeah, so we set up a follow-up appointment to review the results in detail. In that appointment, I review the results in a lot of detail. I go over everything that we know so far about this new condition, the TRAF7 disorder, all the known literature out there, any patients that we know of, and then any support groups. So that's where, I think a lot of patients might want more information is, are there other people in the world with the same condition that I can connect with? So giving them that connection really helps, empower them and give them the tools that they need to, understand this condition better.
That is such a great part of this story. Alicia, you were sharing with us that for a long time, you thought you and your mom were two of just a handful of people in the whole world with this. Is that right?
Yeah, that's correct.
And then what happened when you joined the support groups? you joined those support groups for TRAF7 disorder, and what did you find?
I found that, you know, we were not the only ones. Having a rare disorder, especially something so rare, and what we thought was, you know, so incredibly rare that, you know, we were pretty much the only ones. It can be very isolating, you know, growing up, not really having anyone that I could talk to, you know, that has what I have, other than, you know, my mom. And it just, you know, seeing maybe certain other disabilities, they could find support groups and just talk to other people who have it. And I did kind of wish that I had that growing up.
Because you've shared that throughout all this with the support groups that you were connected with, you're meeting lots of little kids and families that you see so much of yourself in.
Yeah, it's really surreal because for a long time I kind of was under the impression I was the youngest person with this disorder, well, known to have this disorder. And then when I found a support group, I see all these like little children who have the same like skeletal abnormalities that I had or have. And just, you know, when I look back at old like baby pictures of myself, I do see, you know, the differences compared to other children. And to see those differences in other children was just like mind-blowing for me. It seems so little, but it was huge.
Well, you're such a cool person. You're so interesting. And I would imagine for other parents who have children with this, it must be pretty neat for them to now have this role model for their children and this neat person that they could look up to. I bet that's just so comforting for them. And it makes sense that you wish you could have had that when you were little. Dr. Hoos Thompson, I want to ask you, how does this diagnosis alter Alicia's continuing cardiology care as far as treating or monitoring her symptoms?
From that perspective, there's not a lot of difference as far as, again, it's such a relatively new field. It's just awareness, not just of what the cardiac implications are, but the fact that the condition overall, other of her body that are different from the typical person. You have to keep those in mind when you take care of a specific part. So I think, if anything, it doesn't implicate things for the heart, but when you make a decision about one aspect of the condition, you have to be careful because you don't really know what that means for the whole part of it, if that makes sense. I mean, you have to be really careful that you don't isolate it as much because it is part of a syndrome in a whole body process. It's not just an isolated thing.
Sure, that would make sense. So Farah, when you conduct this genetic testing, are you specifically looking for, or were you specifically looking for TRAF7 disorder? Did you have an idea like she might have this? Or were you testing for a whole panel of possible genetic misspellings or complications?
Great question. So the testing that we did is called exome sequencing. It's a test that looks at all known genes that cause human diseases. So it's looking at thousands of genes, not only the TRAF7. And what they're doing is reading through each one of those genes for Alicia and checking to see if there are any genetic changes that make sense for her that would explain her medical and family histories. So that's the testing that we did for Alicia. It's a pretty comprehensive test.
And that's what popped up, and Alicia was the first ever.
The first ever for me to come up with that condition.
That's wild.
But yeah, now I have Alicia as a patient who has all of these great stories to tell. And if other patients would like to connect with her, I know that she would be more than happy to help guide them through this journey as well.
It's so great. And we already have some questions and comments coming in. So if you have a question or a comment that you'd like us to read out loud on the program, you can send it to us right now on YouTube, Facebook, or the All Things Heart email. All the links on how you can connect with us in real time are right there on your screen. Now, Dr. Hoos Thompson, a question I have is, Alicia already has mitral valve prolapse. How might the TRAF7 disorder further affect the function of that valve over time?
It actually is pretty stable at this point. Whenever you see the prolapse of a valve, and usually it is the mitral valve that develops that, it really is just a monitoring as far as how quickly it progresses or becomes more problematic for her. There's no set rules, and a lot of it for symptoms and tolerance, as well as how things are going on other fronts and with other aspects of her condition. So it's something that we monitor, but for the most part, her heart has actually done very well as far as what we found. And while I still see her on a regular basis, I can do so at a pretty good distance, or not very frequently, knowing that, one, she's a very reliable person. She's going to let us know if there's something going on or things like that. But it's actually been pretty stable for her.
Alicia, you talked about how it also could affect the brain. Your mom actually shared with us. Your mom is so sweet. She shared that your mom had a brain tumor. Do you have to get any scans on your brain?
Yeah. Actually, I think I need to make an appointment. Thanks for the reminder. Yeah, I'm
going to call you after the show and go over these things.
I need to get some scans.
You need to get a scan. And how is your mom doing? I know we didn't want to drag her out of bed early, but how is she doing this morning and just in general?
She's doing all right. You know, she's hanging in there.
You had said that the disease also had affected her hearing, TRAF7 disorder. Is it affecting yours at all?
Yes, I do have hearing loss, mainly in lower frequencies. But it's not as significant as my mom's, at least yet.
Farah, what did the genetic testing look like? What's the process?
Yeah, so we can do genetic testing by collecting either a blood sample, a cheek swab, a saliva sample, and for Alicia, I believe we did a blood sample. So by doing that, she just goes down to the lab for a blood draw, and we send the testing to a third-party lab that does the analysis for the genetic testing.
Because this genetic testing can reveal this wealth of information, why wouldn't it just be offered as part of a random physical that every child gets when they go in for their first real physical?
So it really depends on what every patient is presenting with. Testing someone who does not necessarily have any medical concerns may not show us anything in terms of anything genetic going on.
Could it show something that is kind of lurking in there that might develop later?
Yeah. So that is possible, especially with the more comprehensive genetic tests like exome and genome sequencing. These are tests that are typically offered for patients with more complex medical histories.
Okay.
So they have to have, major medical concerns going on, like being born with a heart defect or neurodevelopmental delays or skeletal abnormalities, and in order to prompt us to, order this kind of genetic testing. As part of the consenting for the tests, we have to go over possible results that we can get with genetic testing.
Oh, okay.
And some of that is either new information that you may not have known about previously that could alter the course of your medical treatment or health. We could also learn about hereditary cancer conditions or other forms of hereditary cardiovascular diseases. So all of these things are things to consider for patients. Some patients do not want to know all of this information because they hesitate to have that burden of knowing that they are at risk for something. And just do not want to learn that. Others want all the information out there. I want to know everything about all my genetics. So it really is, you know, a mindset.
It's emotional.
It is very emotional.
You just sparked my memory because I have a good friend who has Huntington's disease. He was diagnosed after he already had a little girl, and he and his partner made the decision that they don't want her, they don't even want to know until she's 18, and then they're going to ask her if she wants to get tested because the treatments are limited, and he just didn't want that burden on his daughter.
Exactly.
So I can completely see that. Alicia, you're such an interesting person. You're, in addition to being an artist, you're a seamstress, you're a filmmaker. One of the neat things about you, out of dozens, is you have a movie out on Amazon Prime that you and one of your best friends have done, and that's you starring in the movie, right?
Yes.
And what's the movie called, and what's
We kind of co-wrote and produced it too.
What's it called?
I'm sorry, can you repeat that?
Yeah, sorry, we have a little bit of a delay.
It's called 12th Floor.
What's it called?
It's called 12th Floor.
Okay.
12th Floor.
And what's it about?
And it's about a girl who has to move back home with her mom, and my mom also played my mom in it.
So
And she's kind of, she doesn't get along well with her mom, and she's kind of bored. She doesn't like the direction her life is going, and she develops a bad habit of looking into people's windows with binoculars.
Okay, okay, kind of like the Hitchcock
And then she
vibe.
ends up witnessing something she should not have.
Okay. Ooh, I like
So
that.
yeah.
So it's kind of a creepy movie. I love creepy movies. And my husband and I differ. He likes rom-coms. I like the scary ones. So I got to watch your movie. I want to also ask you real quick about
Well,
your
thank
cosplay.
you.
Your cosplay and the conventions you attend. How long have you been doing cosplay and making your own costumes? And how has that changed with your joint and mobility issues?
Oh yeah, that's a good question. I think I started teaching myself how to sew around 2014, 2015, and when I first started cosplaying, I would just find pieces of clothing that I already had and then just kind of put them together. But as time went on, I decided to just kind of learn more about actually sewing and patterns, and now I'm making full-on evening gowns and
talented.
corsets and everything. But then when it comes to like my mobility, that's when it gets really tough, because my hands have definitely gotten worse over the years, and I think while all my joints are pretty loose, I think my hands took the worst of it, probably because I've been an artist for pretty much my whole life with so many different mediums, and sewing is very hands-on. You know, I have to work on a pattern, cutting the fabric, the actual sewing. It is a lot of work, and my hands, yes, my thumbs are permanently dislocated, but pretty much every single joint in my hands
And you
are
still
constantly dislocating also.
And you still keep going, and you create
So
such
it's-
beautiful things. We do have one question.
Well,
we
I
asked-
mean, you know, I was just gonna say, I mean, you know, it's worth it at the end.
Sure is. We have one question from our viewer. Jeremy Yenser wants to know, when treating somebody with something so rare, is it more about treating the individual symptoms that pop up? Because there aren't many examples to go off of on the treatment. I'm going to ask Dr. Hoos-Thompson this. Are you treating the symptoms, trying to find things that will cure it? How does this work?
Yeah, I think that's a great point by the person asking the question is yeah, for the most part, you do. You manage the symptoms, you manage things that give them limitations or set them up for complications. And so it gets overwhelming when you have a syndrome and there's multiple different areas of your body that are impacted. Alicia, like she just described, you focus on the things that help her function to do the things she cares about and try to set her up for the best. And so sometimes, even if you see something doesn't work quite perfectly or what you consider normal, it doesn't have to be normal to be effective. And so you have to be careful that we don't over intervene, because a lot of times, again, you're sometimes altering something that it actually serves well in the place it's at.
As we wrap up this discussion, I want to get some takeaways. And Alicia, I want to start with you. What's the one thing you want our viewers to take away from this discussion?
I would say that learning information about genetics is, I would say it's really important, just to know as much as you can about yourself.
That
because it can open so many doors.
And Farah, what about you? What do you want people to know?
I think Alicia's story really highlights what many people with rare diseases go through when they're on their diagnostic odyssey, and genetic testing can help them sometimes in finding answers. And just watching her story unfold really reminded me of why I do this, and hopefully bringing people together in terms of communities of rare diseases, and just giving them hope and empowering them.
And Dr. Hoos-Thompson, what about you? What's your message as a cardiologist?
We have so many tools in medicine when it comes to testing things like that. And sometimes how we use those tools and then apply those tools, there's some unknowns there that we have to be aware of. And so genetics is an amazing field, but I would tell you, I personally get overwhelmed with it in a hurry, and have been doing a lot for my own understanding to get better at it. So be careful of the Pandora thought. While we can have these great stories like Alicia's where you do get better understandings and better kind of focus, other times it can lead you into a jungle and you don't know where to go. So just it is an individual decision, and it's something that we always talk about, working in teams, that it's really important you have a team and a support, and that you're not going into it alone, and you know who to turn to if it does happen or what you find out.
Dr. Hoos-Thompson, thank you. And thank you to Farah and Alicia for joining the conversation. And Alicia, thanks for sharing your journey. We also want to share some great news with you. Big celebration, because once again, the University of Kansas Health System is recognized as a magnet hospital. Now, magnet designation is a worldwide designation hospitals earn from the American Nurses Credentialing Center if they meet the rigorous criteria for patient care and nursing development. The University of Kansas Health System not only earned magnet designation yesterday, it earned magnet designation with distinction, which is even more rare and seldom earned. We're the largest health system to earn this rare distinction. So as we end our program today, let's show you why this will benefit so many patients.
I think an outward sign to people that some great things happen at our place. And we always say, of course, it's about nursing, because it can and should be. It's a designation given by the American Nurse Credentialing Center. But at our place, it's about our entire hospital. We're a magnet hospital. Of course, it's about nursing, and it's about the profession of nursing and the remarkable nurses that we have. You can't have a great hospital without great nurses. I know it. I know it for sure. We also have great people throughout our entire organization. I think people see see that.
Being a magnet designated institution for the 5th time and with distinction, it's special, it's rare, it's something that to our team is so very important, and it's important for nurses that are looking for places to serve. It means that you have an excellent culture for your nurses to work amongst, and that they're valued, and that they have opportunities for growth and so much more. And so this is really important not only to our team here today, but to nurses who join us in the future.
I think it's just a acknowledgement of just the great team that we have here. I mean, we know we're an outstanding team of people that take great care of patients and family members, but to have someone come outside the organization into our place and spend a week with us and come out and tell us what they told us today just validates what our team does each and every day.
Congratulations on your 5th designation with distinction.